Well, we're really excited to have you on the show, and I'd love to hear about what you're doing as an infection preventionist with PDI Healthcare.
Yeah, so this is actually a complete career shift for me, or at least it seemed like it. And in the last 3 years I've been at PDI, I realized it's not that much different. So instead of being an infection preventionist for a facility or a health system, I am a clinical science liaison at PDI, which means that I'm basically an infection preventionist for all the hospitals in a given territory, which in my case ranges from the Dakotas in the west to Ohio and Michigan in the east, from Minnesota down to Tennessee. If you are a hospital in one of those states of that part of the country, I'm your clinical science liaison. Now, what that actually means is that I'm the one that helps the end users. I help on two different fronts. One is I help the end users with any questions that come up with the use of PDI-related products or contexts in which they're used. And that can include things like going to a facility and offering to do clinical assessments where they are looking at an increase in central line associated bloodstream infections. They're not quite sure why. They'd like an outside pair of eyes to take a look at it. I'll go in there and observe insertion, care, maintenance technique, and then provide recommendations on how what I've observed might be different from recommended best practice or national guidelines. And then on the PDI company side, I also act as sort of the voice of the end user. Due to my career in infection prevention and healthcare, I can provide insight to research and development opportunities, conversations about what are the important and pressing things, and as well as educating our team at PDI about new and emerging pathogens. Not like we've had any of those since I started. So I really ended up being an infection preventionist for a bigger, broader audience, which is actually kind of fun.